Hey everyone, and welcome back for another deep dive. Today we're going to be getting skin deep, exploring some common skin conditions and treatments, and just looking at some things to look out for.
It's fascinating how our skin is really like a reflection of what's going on inside.
Okay, so let's start with something I think we all have at least a little bit of experience with, right?
Yeah.
Lice. Everyone remembers those tiny little creatures.
Oh, yeah.
Those tiny little creatures and their even tinier eggs, nits, clinging to hair shafts. Ooh, just the thought of it makes my skin crawl.
Whoa.
What is it about lice that causes that really intense itching?
It's actually an allergic reaction to the saliva that lice inject when they bite.
Oh, ew.
Yeah, not pleasant.
And permethrin or Nix, that's usually the go-to treatment, right?
Yeah.
But I know Lindane, another treatment, isn't recommended anymore.
You're right. Lindane used to be very common, but research showed that it could be toxic to the central nervous system,
Oh, wow.
especially with repeated use, so it's best to consult your doctor before using any treatment, especially on children.
Yeah, always a good idea to check with your doctor. Speaking of tiny creatures that cause big trouble,
Yeah.
let's talk about scabies.
Yeah.
I always think of this as something you hear about in history books, but it's still around, right?
Oh, absolutely. Scabies is caused by microscopic mites that burrow into the skin, and you'll often see those telltale wavy red lines,
Oh, yeah.
and the itching can be absolutely relentless.
So how do you get rid of these mites? Is it similar to treating lice?
There are special creams called scabicides that can kill the mites, but just like with lice, hygiene is key.
Right.
Washing clothes, embedding in hot water, disinfecting personal items, all crucial steps to prevent reinfestation.
Okay, good to know. Now, let's move on to something a little different, Tenia. It's a fungus, right? And it can show up at all sorts of places.
Yeah, we're talking about a whole family of fungi that just love to hang out on our skin, scalp, and even our nails.
So like ringworm, with that telltale ring-shaped rash.
Exactly. Ringworm, or Tinicorporis, is probably the most recognizable form. But then you've got athlete's foot, or Tinea which thrives in those warm, moist environments like showers and locker rooms. Hence the importance of flip-flops.
Oh, for sure.
And then there's jock itch, or Tinea cruris, which can affect anyone, not just athletes.
And I was reading that Tenia can even affect the scalp.
Absolutely. Tinea can cause scaly patches on the scalp and can even lead to hair loss.
Oh, wow.
And visually, these fungal infections, they can be kind of unpleasant. Fissures, vesicles,
Yikes.
definitely not something you want to ignore.
No, for sure not.
Uh-huh.
So what are our options when it comes to dealing with these uninvited fungal guests?
Well, topical antifungals are usually the first line of defense, but sometimes oral medications like diflucan or fluconazole might be necessary.
Fluconazole, that sounds kind of familiar. Isn't there something about potential side effects with that one?
Yeah, you're right. While generally safe, fluconazole can potentially affect the liver and kidneys, so it's important, especially with long-term use, to monitor those organs
Right.
with regular blood tests, checking creatinine, BUN, liver function tests.
Got it. So monitoring is key there. Now let's move on to a condition I think a lot of people kind of dread the name. Shingles. It's caused by the chickenpox virus, but it
Yeah.
seems like you get it much later in life, right?
Yeah, it is. The varicella zoster virus, the one that causes chickenpox, can actually lie dormant in our nerve cells for years and years.
Wow.
And then, sometimes triggered by stress or a weakened immune system, it can reactivate and cause shingles.
So like chickenpox round 2. But it usually affects a specific area of the body, right?
Yeah, it typically affects one side of the body following the path of a nerve, and those painful, blistering rashes are definitely not fun. Along with the rash, people often get fever, headache, just a general feeling of malaise.
Oh, no fun at all. So stress is a major trigger, huh? I can see why people would be concerned about that. And what's this about the virus lurking in our spine? That sounds a little creepy.
It does sound a bit eerie, right? Essentially, after you have chickenpox, the virus retreats to these nerve clusters near the spinal cord called ganglia. And it can stay there quietly for decades
Oh, wow.
until something triggers it to reactivate. And while anyone who's had chickenpox can get shingles, it's more common in older adults or those with compromised immune systems.
Okay, so preventing shingles, or at least minimizing the risk, is all about managing stress and keeping our immune system strong. But what happens if you do get shingles? Is it treatable?
Absolutely. Antiviral medications like acyclovir can help shorten the duration and severity of the outbreak. Corticosteroids can be used to reduce inflammation and pain relievers can help manage the discomfort.
Okay, that's good to hear. And what about the contagiousness of shingles? I know there's a lot of concern about that. Is it contagious like chickenpox?
It's a common concern. While shingles itself isn't contagious, The virus that causes it can be spread to someone who's never had chickenpox.
Oh, okay.
However, the virus is only spread through direct contact with the fluid from the blisters, not through coughing or sneezing.
Okay.
Once the blisters have crusted over, the risk of transmission is greatly reduced.
So basically, if you have shingles, keep those blisters covered and avoid close contact with anyone who hasn't had chickenpox.
Exactly.
And I was reading that there's a vaccine for shingles now.
Yes. There's a vaccine available for adults over 60,
Okay.
and it's highly effective in preventing shingles and reducing the severity of symptoms if you do happen to get it.
That's great. Okay, so we've covered the scary kind of herpes. Let's talk about the more common and much less scary type.
Yeah.
Herpes simplex. I think most people are pretty familiar with those cold sores or fever blisters.
Right. Herpes simplex virus type 1, or HSV1, is incredibly common.
Yeah.
In fact, most people are infected with it during childhood, often without even realizing it.
So that explains why those cold sores seem to pop up out of nowhere, like, hey, what's up?
Yeah, exactly.
But isn't there another type of herpes simplex?
There is. Herpes simplex virus type 2, or HSV2, is typically associated with genital herpes, and while both types can cause those telltale clusters of painful, fluid-filled blisters,
Right.
they tend to affect different areas of the body.
And how do you treat these different types of herpes?
Antiviral medications like acyclovir are the mainstay of treatment for both HSV1 and HSV2.
Okay.
They can help shorten the duration of outbreaks and reduce the severity of symptoms. For HSV1, topical antiviral creams can be quite effective, but for HSV2, oral antiviral medications are usually preferred.
Okay, so acyclovir is kind of the go-to medication for both types of herpes simplex. Now, let's shift gears to a more serious topic. Skin cancer. I think most people know that too much sun exposure can increase your risk, but what are some things we should be looking out for?
That's right. Sun exposure is a major risk factor for skin cancer, but it's not the only one. Family history, certain genetic predispositions, even fair skin can play a role.
So what are the signs and symptoms that should send us running to the dermatologist?
Any new or changing moles, especially those that are asymmetrical, have irregular borders or have changed color. Any sore that doesn't heal, any spot that bleeds easily, or any crusty or scaly patch of skin should be checked out.
Okay, so pretty much any changes, be on the lookout, go get things checked out.
Yeah, it's better to be safe than sorry.
And what about the different types of skin cancer? I know there are a few, and some are more serious than others.
There are three main types: basal cell carcinoma, squamous cell carcinoma, and melanoma.
Okay.
Basal cell carcinoma is the most common and tends to grow slowly. It often looks like a pearly or waxy bump or a flat, flesh-colored or brown scar-like lesion. Squamous cell carcinoma is the second most common type, and it can also grow slowly, but it's more likely to spread than basal cell carcinoma.
Okay.
It often looks like a firm red nodule or a flat lesion with a scaly, crusted surface.
And then there's melanoma, the most serious type.
Right. Melanoma can develop anywhere on the body, but is more common in areas that have been exposed to the sun. It can look like a new mole or a change in an existing mole.
Okay.
The key is to be aware of those ABCDEs of melanoma detection: asymmetry, border irregularity, color changes, diameter larger than a pencil eraser, and any evolving changes.
So early detection is key, especially for melanoma.
Absolutely.
And of course, preventing sun damage in the first place is crucial.
Yes, wearing sunscreen with an SPF of 15 or higher, seeking shade during peak sun hours, and wearing protective clothing like hats and sunglasses.
Now let's move on to another situation where early intervention is critical. Burns. Seems like a pretty straightforward injury, but there's a lot more to it than meets the eye, right?
Absolutely. Burns can be incredibly complex, and the severity can range from minor superficial burns to life-threatening full-thickness burns
Wow.
that involve all layers of the skin and underlying tissues.
So what should we do if we encounter a burn situation? What are the first steps?
The first priority is always safety. Make sure you're not in danger yourself before approaching the situation. Once the scene is safe, assess the victim's airway, breathing, and circulation.
Okay.
If there's any sign of difficulty breathing or if the person is unconscious, call 911 immediately.
And what about the burn itself? I know there are different degrees of burns, but what should we do in the meantime?
For minor, superficial burns, cool the burn immediately with cool water for 10 to 15 minutes.
Okay.
Don't use ice, as this can further damage the skin.
Okay.
Once the burn is cooled, cover it with a clean, dry dressing.
And what about those more serious burns? What are some danger signs that should prompt a call to 911?
Any burn that covers a large area of the body, any burn on the face, hands, feet, genitals, or major joints, any burn that appears charred or leathery, and any burn that causes difficulty breathing or changes in consciousness.
Okay, so those are all red flags.
Those are all definitely red flags that require immediate medical attention.
And what about that black sputum you mentioned?
That's a sign of a possible inhalation injury, which can be life-threatening. It means the person may have inhaled hot smoke or chemicals,
Oh, wow.
which can damage the lungs. If you see black sputum or if the person is coughing up soot, call 911 immediately.
Okay, so airway and breathing are the top priorities. Then comes assessing the burn itself. But what about fluids? I know that's a big concern with burns.
It is. Burns can cause significant fluid loss, leading to dehydration and shock.
Right.
That's why intravenous fluids are a crucial part of burn treatment.
Okay.
In the first 24 hours after a major burn, lactated Ringer solution is typically used to help stabilize the patient's fluid and electrolyte balance.
That makes sense. And I imagine preventing infection is also a major concern with burns, right?
Absolutely. Burns are highly susceptible to infection because they create an open wound that allows bacteria to enter the body.
Right.
That's why meticulous wound care and infection control measures are essential.
And what about the different depths of burns? I know they're classified by how deeply they penetrate the skin.
Right. Superficial burns affect only the top layer of skin and are characterized by redness, pain, and mild swelling.
Oh.
Partial thickness burns involve the top 2 layers of skin and are characterized by blisters, intense pain, and redness. Full thickness burns extend through all layers of the skin and may even involve underlying muscle and bone. These burns often appear white or charred and may not be painful because the nerve endings have been destroyed.
So those deeper burns can be really serious and require, specialized treatment, I'm assuming.
They do. Treatment for deep burns may involve surgery to remove dead tissue, skin grafting to replace lost skin, and long-term rehabilitation.
Now, I know you mentioned that those capillaries leak fluid into the interstitial space in the first 24 hours after a burn. Can you explain what that means in simpler terms?
Sure. Think of the interstitial space as the space between the cells in your body. It's like a sponge that holds fluid. When you have a burn, the capillaries, those tiny blood vessels, become leaky, and fluid from the bloodstream seeps into the interstitial space, which can lead to swelling and further fluid loss.
So that's why intravenous fluids are so important, to replace the fluid that's being lost and prevent dehydration.
Exactly. And it's not just about replacing fluids. Burn patients also need a significant increase in protein and calories to help their bodies heal.
Right.
We're talking about triple the usual protein intake and a significant increase in calories.
Wow, that's a lot. So nutrition plays a huge role in burn recovery.
It really does. It's a critical component of healing and rehabilitation.
Okay, let's move on to something that, while not life-threatening, can definitely impact quality of life. Acne. Something that most of us have experienced at some point, especially during those teenage years.
Ah, yes, acne vulgaris. Those pesky pustules and blackheads fueled by hormonal surges and overactive sebaceous glands.
This is so fun.
Yeah, incredibly common, affecting up to 85% of teenagers.
And it's not just teenagers, right? I know plenty of adults who still struggle with acne.
Absolutely. Acne can persist into adulthood, and for some it can be a lifelong challenge.
So what can we do about it? I know there are tons of products out there, but what actually works?
Well, the good news is that there are many effective treatments for acne, ranging from over-the-counter products to prescription medications.
Like those gentle cleansers and benzoyl peroxide creams I see advertised everywhere.
Those can be helpful for mild acne. Benzoyl peroxide helps to kill bacteria and dry up excess oil, while gentle cleansers help to remove dirt and impurities without irritating the skin.
And what about those prescription medications? I know there's some pretty powerful options out there.
There are. For moderate to severe acne, a dermatologist might prescribe topical or oral antibiotics, retinoids, or even oral contraceptives for women.
And what about Accutane? I've heard that's a pretty effective treatment for severe acne.
Accutane, or isotretinoin, is a powerful oral retinoid that can be very effective for severe cystic acne. However, it does come with potential side effects, including dry skin, mood changes, and even birth defects if taken during pregnancy.
So definitely not something to be taken lightly.
Absolutely. It's a medication that requires close monitoring by a dermatologist.
And I know there's another acne medication called tetracycline. I remember my sister taking that when we were teenagers.
Tetracycline is an oral antibiotic that can also be effective for acne. However, it's important to take it on an empty stomach and avoid dairy products, as these can interfere with its absorption.
And I seem to remember something about avoiding the sun while taking tetracycline.
Yes, that's right. Tetracycline can make your skin more sensitive to the sun.
Right.
So it's important to wear sunscreen and avoid prolonged sun exposure while taking it.
So lots of things to keep in mind with acne medications. Now, before we move on, I want to quickly touch on two more conditions: pressure injuries and cellulitis. Pressure injuries, or bed sores, as they're often called, are a concern for people who are bedridden or have limited mobility, right?
That's right. Pressure injuries develop when there's constant pressure on the skin, cutting off blood flow and damaging the tissue.
Right.
They're most common on bony areas like the heels, hips, and tailbone.
And what can be done to prevent them?
Frequent repositioning is key.
Okay.
For bedridden patients, that means turning them every 2 hours to relieve pressure on different areas of the body. Keeping the skin clean and dry is also important, as moisture can increase the risk of pressure injuries.
And what about cellulitis? That's a bacterial skin infection, right?
It is. Cellulitis is a common skin infection that occurs when bacteria enter the skin through a cut, scrape, or other break in the skin.
Okay.
It causes redness, swelling, pain, and warmth in the affected area.
So how is it treated?
Antibiotics are the mainstay of treatment for cellulitis.
Okay.
Depending on the severity of the infection, they may be given orally or intravenously.
Okay, so we've covered a lot of ground here. From pesky lice to serious conditions like skin cancer and burns, it's amazing how diverse and complex our skin can be. And it's incredible how our skin can reflect our overall health.
It really is. The skin is an incredible organ, and it's worth taking the time to understand how to keep it healthy.
Well, I'm already feeling more informed, and I'm sure our listeners are too. We'll be back after a short break to dive deeper into some of these conditions and explore what they can tell us about our overall well-being.
Sounds good. It really is amazing, how much we can learn about our health just by looking at our skin.
It's funny, we often think of skincare as, like purely cosmetic, but it's so much more than that. It's about protecting our largest organ and understanding what it's trying to tell us.
Exactly. And we've covered so much already, from those microscopic mites causing scabies to the potential dangers of melanoma. It's a lot to take in.
Yeah, it really is. And speaking of taking things in, we've talked about a lot of different medications and treatments. For someone who isn't a medical professional, it can be kind of overwhelming trying to keep it all straight. What are some key things our listeners should remember when it comes to treatment for these skin conditions?
I think the most important thing to remember is that every medication has potential side effects. It's never a one-size-fits-all approach. That's why having an open and honest conversation with your doctor is crucial.
So it's not just about blindly following instructions, but really understanding what you're putting into your body and why.
Exactly. Don't be afraid to ask questions, even if they seem basic. Your doctor is there to help you navigate those complexities and find the treatment plan that's right for you.
And on that note, let's shift gears a bit and talk about prevention. What are some simple things we can all do to keep our skin healthy and happy?
Well, we've already touched on the importance of sun protection. Wearing sunscreen with an SPF of 15 or higher is non-negotiable even on cloudy days.
And reapplying every 2 hours, especially if you're sweating or swimming, something I definitely need to work on.
We've all been there. Another important aspect of skin health is hygiene. Keeping your skin clean and dry can go a long way in preventing infections like cellulitis.
Makes sense.
Yeah.
And for those of us who battle acne, what are some good habits to keep in mind?
Using a gentle cleanser and avoiding harsh scrubbing can make a big difference. And resist the urge to pick or squeeze those blemishes. It can actually make things worse and lead to scarring.
Oh, the temptation is real, though. But you're right. It's better to leave it to the professionals.
Exactly. Speaking of professionals, it's important to be proactive about your skin health and see a dermatologist if you notice any changes.
Like that new mole or a rash that won't go away, any suspicious spots.
Right. Early detection is key, especially when it comes to skin cancer. Regular skin checks, even if you don't have any concerning symptoms, are a good idea.
So it's like getting an oil change for your car routine maintenance to keep everything running smoothly.
I like that analogy. Now, I want to touch on something we often overlook. The connection between our skin and our overall well-being.
Yeah, this is something I'm really fascinated by. We tend to compartmentalize our health, but it's all interconnected, isn't it?
It absolutely is. Our skin can be a window into what's happening inside. For example, stress can manifest in skin conditions like eczema or psoriasis.
Oh, wow. It's like our skin is trying to send us a message saying, hey, pay attention. Something's not quite right.
Exactly. And on the flip side, taking care of our skin can have a positive impact on our mental health.
That makes sense. When you feel good about your skin, it can boost your confidence and self-esteem.
Absolutely. It's a powerful reminder that self-care isn't selfish. It's essential.
Speaking of self-care, we've discussed some pretty intense conditions today, like shingles and skin cancer. These aren't just physical challenges. They can really take an emotional toll as well.
You're absolutely right. Living with a visible skin condition can be incredibly challenging. It can affect your self-image, your relationships, even your sense of identity.
Especially in a world where we're constantly bombarded with images of perfect skin.
It's so important to remember that those images are often heavily edited and unrealistic. Real skin has texture, it has flaws, and that's perfectly okay.
So true. What advice would you give to someone struggling with the emotional side of a skin condition?
First and foremost, know that you're not alone. There are support groups, online communities, and mental health professionals who specialize in helping people cope with the emotional impact of skin conditions. Don't hesitate to reach out for support.
And sometimes just talking to a trusted friend or family member can make a world of difference.
It really can. Having a supportive network is so valuable. And for those who are supporting loved ones with skin conditions, remember to be patient, understanding, and compassionate.
Just listening without judgment can be incredibly healing.
Absolutely. It's about creating a safe space where people feel comfortable opening up and sharing their experiences.
It's amazing how powerful a simple act of kindness can be. This deep dive has been so insightful, not just about the science of skin, but also about the human element.
I agree. It's a reminder that we're all in this together.
And speaking of being in this together,
Yeah.
I have a question for you that's been on my mind.
I'm all ears.
We've talked about how our skin reflects our overall health, but what about the reverse? How can taking care of our skin actually benefit our internal health? Is there a connection there?
That's a fantastic question, and it's an area of ongoing research. But we do know that the skin plays a vital role in protecting us from infection, regulating body temperature, and even producing vitamin D.
So when we protect our skin from sun damage, for instance, we're not just preventing wrinkles and age spots, but we're also protecting our immune system and our overall health.
Exactly. And emerging research suggests that the skin may play a role in regulating our metabolism and even influencing our mood.
That's fascinating. So it's a two-way street. Taking care of our skin benefits our internal health and vice versa.
Precisely. It's a holistic approach to well-being, recognizing that our physical, mental, and emotional health are all interconnected.
This brings up another question for me. We've covered a lot of common skin conditions, but what about those rarer, more complex conditions? What advice would you give to someone facing a diagnosis that's unfamiliar and potentially frightening?
That's a great question. It can be incredibly overwhelming to receive a diagnosis that you don't understand, especially if it's a rare or complex condition.
Yeah, it can feel very isolating.
Absolutely. My advice would be to seek out specialized care from a dermatologist or other medical professional who has expertise in that specific condition.
So finding a doctor who truly understands your unique needs.
Exactly. Don't be afraid to ask for second opinions, to do your own research, and to advocate for yourself. It's your health, and you have the right to be fully informed and to seek the best possible care.
And what about the emotional side of things? How can someone navigate the fear and uncertainty that often comes with a rare diagnosis?
That's where support groups and online communities can be incredibly helpful. Connecting with others who are going through similar experiences can provide a sense of validation and hope. It can also be a source of valuable information and resources.
It's that human connection again. Knowing that you're not alone in this journey can make all the difference.
It really can. And for some, seeking professional counseling or therapy can be incredibly beneficial. It's a safe space to process your emotions, to develop coping mechanisms, and to build resilience.
It's about taking care of your mental and emotional health along with your physical health.
Absolutely. It's a holistic approach to healing.
This conversation has really highlighted the importance of advocating for ourselves, asking questions, and seeking out support when we need it.
And I think it's also highlighted the importance of staying curious and informed about our health. The more we learn, the better equipped we are to make informed decisions about our care.
I couldn't agree more. Well, we've explored a wide range of skin conditions today, from the everyday to the more complex. What are some final takeaways you want to leave our listeners with?
I think the key message is that our skin is an incredible organ worthy of our attention and care. By understanding the signals it sends us, we can gain valuable insights into our overall well-being.
And by embracing prevention, seeking appropriate treatment, and fostering a positive mindset, we can empower ourselves to live our healthiest lives.
Beautifully said.
You know, it's amazing how something as simple as our skin can tell us so much about our overall health.
Right, like a tapestry, it's woven with all these threads of our genetics and our lifestyle and our environment.
And, sometimes those threads get all tangled up.
Exactly.
Then that results in some of these conditions that we've been discussing. But just like with a tangled tapestry, we can learn to kind of, you know, identify those knots and gently unravel them and restore the beauty of the whole.
That's a great way to put it.
So as we wrap up our deep dive into the world of skin, what's the one message that you hope our listeners take away from all this?
Well, I think the most important takeaway is that knowledge is power. The more we understand about our skin, the better equipped we are to really take care of it.
And that includes being aware of the common conditions, knowing when to seek help, and just practicing good skin hygiene.
Exactly. And it's not just about ourselves, right? By understanding these conditions, we can also be more compassionate and supportive of others who are struggling.
That's a really good point. It's about creating a culture of awareness and understanding around skin health.
Exactly.
Well, we've covered a lot of ground today, from those everyday nuisances to some more serious concerns. Anything else you want to add before we wrap things up?
Just a reminder that there's always more to learn. The field of dermatology is always evolving, with new research and treatments coming out all the time.
So stay curious, keep learning, and don't be afraid to ask questions.
Right. And most importantly, take good care of your skin. It's the only one you've got.
Love that. Well, on that note, we'll wrap up this episode of The Deep Dive. I hope you enjoyed this exploration of the incredible world of skin. We encourage you to continue learning, asking questions, and taking care of your amazing skin. Until next time, stay curious and keep diving deep.